Hi there, I'm Dr. Stephanie Falk, and today I want to address how we can help a loved one, a friend, or a family member who might be struggling with depression. I think that when we notice that someone seems a little bit off, someone seems irritable, fatigued, maybe not interested in things in the way that they usually are, they don't really feel engaged with us, they seem to be sad or have mood swings. I think that we become really concerned, but I don't often know that we understand how to approach them in the best possible way and how we can support them. And so I want to shed a little bit of light on that topic. I think the first thing that we can do is educate ourselves. So, what is depression? What does it look like? What do people feel and think when they're experiencing depression? That allows us to approach our friend or our family member in a way that's informed, in a way that says, hey, I care so much that I did this research, that I know a little bit about what you might be experiencing, and I'd like to have a discussion about it. So educate and inform yourself as it relates to what the experience of depression might be like. Secondly, I think a really good way to approach someone is to express concern and express care. Hey, I'd love to be able to talk to you. I've been a little bit concerned. You just seem like you've been off. That might be a good benign way to approach someone. And through the conversation, really, I think what you want to do is you want to be a really good listener. It's not your job to fix the situation or to overly explain the experience of depression to someone because they're the ones going through it. And it's important to be able to convey that you understand just a little bit of what it might be like, but you don't get and understand their experience. So really take on an active listening sort of role. One thing that you want to be able to do also is encourage them to seek support. So in the way that you're talking to them, be really careful not to use language that might stigmatize their experience. Rather, use language that normalizes, hey, a lot of people experience depression and anxiety, and I'm sorry that this is your experience. I know that it's a serious thing. I also know that it can be treated. Have you thought about seeing a therapist? Have you thought about seeing your medical provider? I think that can be some really good language to use. The other thing that can be really helpful is to offer to go with them to their first appointment. Hey, I'm happy to go with you to the first therapy appointment or to meet with your doctor. I know that it can be a hard thing to do, and I'd love to support you if that feels like it's supportive. Hopefully, I'm giving you a little bit of the language base that you can potentially use as you talk to them about this really sensitive topic. Third, I think another thing that you can do is actively try to support them. Recognize that you're limited, you're their friend or your family member, you're not their therapist, but I think providing them a space to be able to talk about their experience is really helpful. And again, from a listener sort of perspective. I think sometimes when we have an initial conversation about our concern, when we encourage them to seek support, sometimes people kind of think maybe that's a one-time conversation. But if you're their friend or their family member and you want to actively support them, I think checking in with them and providing space for them to have continued conversations about what they're dealing with is a really helpful thing. And in some cases, kind of opening up the door and asking about the depression initially and then not following up can actually be a really hurtful experience because they feel like they were vulnerable with you and now you have insight into what they might be experiencing and then you didn't care enough to follow up. So I would definitely follow up and be able to be a continuous person in their life in which they can kind of go to and let you know, yeah, hey, this is how therapy is going, or this is how I've been feeling, this is how I'm doing, can be really supportive. Another active stance that you can take is perhaps suggesting that you can be their workout partner, maybe someone that can take walks with them. Encouraging them to get some physical activity can really support and elevate their mood and help them to buffer stressors throughout the day. So that might be a way that you can take an active role as well. Another way that you could take an active role is to do a kind deed. Maybe they're struggling to get out of bed, they're struggling with day-to-day tasks. Definitely not to take everything on because that's not your role. But in being a friend or a family member, maybe offering, hey, like I was hoping that I could mow the lawn for you. I was hoping that I might be able to pick up groceries for you this week. I know it's been a really rough week for you. Those really small and specific task-oriented things that you can do for them can actually make a world of difference and take on a lot of meaning for them in a way that's very healing and helpful. So if you have a friend or a family member that's going through depression, hopefully you've gleaned these three tips. The first one is to educate yourself. The second one is to let them know that you're concerned and encourage that they seek some support and maybe offer to go with them to a meeting or two. And then the last one is to try to identify an active role that you can take. And maybe that's being a listener, maybe that's being a workout partner, maybe that's helping them with a task or two. Another thing that you can do actually is to encourage them to have kind of a loose schedule and maybe one goal a day. That can be helpful. But again, you're not the therapist, but a concerned friend or family member. I hope it's been helpful to listen to this video. I hope that it finds you having an absolutely beautiful day. And if you don't want to miss a video, feel free to subscribe. Thank you very much.